Neck contouring. Post-operative instructions. Once your surgery is completed, it is essential you follow all of the post-operative instructions given to you in order to heal as quickly and safely as possible. The following instructions are your obligation. Waking up from anesthesia. Neck contouring may be performed under local anesthesia, sedation, or general anesthesia. As soon as you wake up from the anesthesia, it is common to feel sore and drowsy. Dressings and post-surgical garments may be placed. You'll be monitored in the recovery room for an hour or two until you are ready to be discharged home. Discharge home. Once you wake up, you'll be discharged home. A driver is required to drive you home after surgery anytime general anesthesia or sedation is administered. It is also a requirement for you to be discharged home to the care of a responsible adult who will stay with you for the first 24 hours after surgery to monitor your health and support you. All of these instructions must be clear to your caretaker. Arrival home. After you arrive home, it is important to rest, to stay well hydrated, and to take medication as prescribed. The time you arrive home can be a good time to take the first dose of ibuprofen and 1 Percocet. The first few days after surgery. Be sure to clear your calendar from any major obligations for at least the first 3 days after surgery. Do not drive, operate heavy machinery, or sign important documents. Prepare your family, friend, or designated caretaker for the first few days. Having help around the house can make a positive difference. Have them keep a journal of your medications and the times you take each one, and have them keep you on the schedule prescribed by your surgeon. What to expect after surgery. The recovery from neck contouring is usually very tolerable. After surgery, you should expect temporary side effects such as pain, soreness, bruising, swelling, numbness, tingling, tightness, drainage, lumpy or wrinkly tissues, abnormal sensations, and fatigue. After neck contouring, the degree of swelling, bruising, numbness, tingling, and tightness can range from mild to moderate to severe. You may experience tightness in the neck and difficulty turning side to side for 1 to 2 months. The neck and lower face can look and feel strange and be distorted from the swelling. You may notice bumps on the sides of the neck and wonder whether your glands are swollen. These bumps are caused by swelling. The tissue temporarily fills with fluid and becomes firm. Sometimes you may feel little nodules under the skin. They typically go away over the course of about 3 months. The skin may feel dry and rough for several months. Some specific areas or a side may be more bruised or swollen than others. The mouth can be especially sensitive. The side effects are most often pronounced during the first few days and gradually improve. No 2 patients are the same. Some people experience more side effects, others less. Some people heal quicker, others slower. Most of our neck contouring patients are able to resume light, low-impact activities within 2 to 3 days. Most patients with sedentary jobs can return to work in a few weeks. Patients with jobs requiring physical activity should avoid lifting, straining, and exertion for at least 6 weeks. Most patients feel healed after 3 to 6 months, but full healing can take 1 to 2 years. It is important for you to follow your surgeon's instructions, including avoiding strenuous activities for at least 6 weeks, to embrace your recovery, and to maintain a positive and patient mindset. Position after surgery and sleeping. Position after surgery when resting and sleeping should be lying on your back with your head elevated at a 30 to 45 degree angle for 6 weeks after surgery. Many patients find a recliner or wedge pillow with an extra pillow under your knees to be most comfortable. Avoid positioning the pillows behind your head in such a way as to cause your neck to be flexed forward. Elevation is most important for the first several days after surgery. Then it becomes more important that you sleep comfortably so you can reduce the amount of elevation. You should not sleep on your side or on your tummy for 6 weeks after surgery. Getting plenty of sleep after surgery is important for your recovery. 8 to 9 hours of sleep per night are recommended to aid your healing. If you are having trouble sleeping during the first 2 weeks after surgery, you may take an over-the-counter sleeping pill or the prescribed sleeping pill. Fluids. Keep yourself well hydrated after surgery. Have at least 12 glasses of water per day for the first 2 weeks after surgery. Drinking water after surgery flushes anesthesia from the body and promotes wound healing. It is easy to become dehydrated after surgery. Dehydration may cause nausea and headaches. Stick to non-carbonated, non-alcoholic, caffeine-free, and green tea-free beverages such as water. Alcohol should be avoided for at least 4 weeks following surgery as it causes fluid retention. Diet. Keep yourself well nourished after surgery. This will aid your healing. The stress of surgery can interfere with digestion, so for the first 3 days after surgery, you'll want to eat soft, easily digestible foods such as applesauce, chicken broth, scrambled eggs, and yogurt. As you regain your appetite, eat a healthy, nutritious diet that includes a high amount of protein, low salt, and low inflammation. Avoid salt, sugar, caffeine, alcohol, and refined carbohydrates for at least 1 month after surgery. Medications. Take all medications as prescribed. Be certain to follow the instructions provided by the pharmacy and written on the labels of the prescriptions. Pain medications. Manage your pain with scheduled pain medicine. Pain and soreness are normal parts of the post-operative recovery period. Medications prescribed are geared towards keeping the pain and soreness tolerable. Unfortunately, it is impossible for our team or the medications to completely eliminate pain and soreness after surgery. If used as prescribed, a large majority of patients tolerate the medications well and go on to heal without consequence. Most patients will be prescribed 2 different pain medications: extra-strength ibuprofen and a stronger narcotic pain medication such as oxycodone, also known as Percocet, or hydrocodone, also known as Norco or Vicodin. When you get home can be a good time to take the first dose of ibuprofen and 1 Percocet. Most patients will take both pain medications for 2 to 3 days, then transition to ibuprofen as needed. However, every person is different. If you do not need the stronger narcotic pain medicine, then it is not necessary to take it. If you do need the stronger narcotic pain medicine, do not be afraid to take it. It is important to keep yourself comfortable. The stronger narcotic pain medication can be hard on your system. It could make you feel drowsy, loopy, constipated, or nauseous, so the less of it you take, and the sooner you discontinue it, the better. Antibiotics. Antibiotics may be prescribed to prevent infection. If antibiotics are prescribed, take the entire prescription until finished. Anti-nausea medicine. The effects of anesthesia can make some patients experience nausea. If post-anesthesia nausea or vomiting occurs, it will typically go away during the first 24 to 48 hours after surgery. You may take the prescribed anti-nausea medicine as needed to help relieve symptoms. The effects of pain medications can also make some patients experience nausea. The surgeon recommends always taking pain medication with a small amount of food and recommends starting with half of a pain pill to see how the medication is tolerated and only taking the narcotic pain medicine as needed. Relaxation medicine. You may be prescribed relaxation medicine such as lorazepam, also known as Ativan, that can help with anxiety and insomnia. If you do not need this medicine, do not take it. However, some patients can find this medicine helpful for a few days or nights to help with anxiety or trouble sleeping. You may take this medication only as needed for up to 3 weeks. Use caution as this medicine may make you feel sleepy or drowsy. GI medicines. Some patients have problems with constipation following surgery. If this occurs, try drinking prune juice or taking an over-the-counter laxative such as docusate sodium, also called Colace, or milk of magnesia. Walking can also help. Blood thinning medications. Avoid all aspirin for 4 weeks after surgery unless otherwise instructed by your surgeon. If before surgery you're regularly taking any blood thinning medicine such as aspirin, Coumadin, also called warfarin, or Pixaban, also called Eliquis, please contact your surgeon for instructions and guidance as to when to resume taking these medicines. Vitamins and supplements. Take a multivitamin and probiotics for 4 weeks before and 12 weeks after surgery. Take vitamins A, C, and zinc for 12 weeks after surgery. Take Arnica montana and pineapple bromelain for 2 weeks after surgery to help reduce bruising. These vitamins can help boost your healing. You may resume other supplements you normally take 6 weeks after surgery. Activity. Rest. Rest is important during the early stages of healing. Walking. However, it is equally important that you are ambulatory. Start walking as soon as possible. This helps to reduce swelling and lowers the chance of blood clots. Take a short walk inside the house every 2 hours while awake to improve circulation during the first 72 hours after surgery. Use assistance if needed and use caution. You may tire easily. Plan on taking it easy for the first week. Exercise. No exercising, lifting more than 10 pounds, or straining for at least 6 weeks after surgery. This includes working out, running, jogging, cycling, swimming, hiking, lifting, carrying heavy objects, and sexual activity. Gentle walks are permitted, and early walking is important. Use common sense. If it feels like too much or hurts, then don't do it. Avoid the temptation to do too much, especially as you start feeling better. Overexertion can cause serious problems such as bleeding and wound disruption. It is important for you to help keep yourself safe. Driving. Do not drive if you are taking narcotic pain medicine, such as Percocet or Vicodin, or relaxing medications such as lorazepam. You may drive with caution in approximately 10 to 14 days and after you have discontinued pain medicine. Leg pump exercises. Please perform leg pump exercises every hour while awake for the first 2 weeks after surgery. To perform the leg pump exercises, squeeze and contract the calf muscles and thigh muscles of both legs for a total of 10 seconds while laying down or sitting. Repeat every hour while awake. This exercise helps to increase the circulation of blood through your legs and helps to prevent blood clots. Deep breathing exercises. We encourage deep breathing exercises after surgery. Take as deep as a breath in as you can, slowly, then slowly exhale. Repeat 10 times every hour while you're awake for the first 3 days after surgery. Dressings and wound care. Keep all dressings clean, dry, and intact. A small amount of blood or drainage from your incisions is normal. If bleeding occurs, apply direct pressure for 15 minutes. If this does not stop the bleeding, contact your surgeon immediately. If you experience continued drainage from the surgical site, you may replace or reinforce the dressing with dry gauze to prevent leakage onto clothing. Incisions. There may or may not be sutures that need to be removed. If there are sutures to be removed, they will usually be removed in 3 to 7 days after the procedure. Apply polysporin antibiotic ointment lightly to exposed incisions or where there is any crusting. If any wound opening develops, please send a photo and notify your surgeon. Do not wear any makeup on or around the operative site until stitches are out and the wound is completely healed. You may apply scar gel once the wound is completely dry and sealed, typically after about 4 weeks. Your surgeon will recommend the best scar gel for you. Showering. You may shower and wash your hair 2 days after surgery. Face away from the shower spray to prevent discomfort. Your wounds may be gently cleansed with a mild soap and lukewarm water. Pat dry immediately afterwards. Avoid pulling or tugging on your hair, as this could put stress on your healing incisions. Because you will have numbness in the face and earlobes, do not use hot rollers, curling iron, or a hairdryer. If you must dry your hair, set the hairdryer on the cool setting. Do not color or perm your hair for at least 6 weeks after surgery. Getting the stitches wet in clean water will not harm them. Until permitted by your surgeon, you should avoid pool water, ocean water, bath water, etc. These are considered to be dirty water. No soaking in the bathtub, hot tubs, or swimming for 6 weeks. Ice and heat. Use ice for 2 days to reduce swelling and pain. Apply ice packs over the neck and face in 20-minute intervals. 20 minutes on, followed by 20 minutes off, while you're awake. Wrap the ice in a cotton towel so it's not too cold on the skin. Your skin will be numb after surgery, so it is important to be careful when icing. Crushed ice in a Ziploc bag or bags of frozen peas work well as an ice pack. You want to avoid heat for the first 3 weeks after surgery, as heat can increase swelling. After 3 weeks, you may apply a warm heating pad as needed for comfort. When applying heat, it is important to be very careful. The sensation of your tissues is usually decreased after surgery, and you may not feel just how hot a heating pack is, and this could cause a significant burn. Garments. Your garment is an important part of your recovery. Your garment should be worn at all times, 24 hours per day, 7 days per week for the next 2 weeks. After the second week, we recommend that you continue wearing the garment while at home for an additional 2 weeks. You may remove the garment for short periods of time to shower, go to the bathroom, or to wash the garment. The garment should be snug, but not tight or painful. Be sure the garment is worn smoothly and do not pinch or put excessive pressure on your incisions or your skin. Be sure to avoid traumatizing your skin when wearing the garment. You may use gauze pads to cover the incisions under the garment for protection. The garment can be an important part of promoting a safe and comfortable post-operative period and proper healing. In certain cases, the surgeon may instruct you to wear the garment for additional time. Smoking. Please avoid all forms of nicotine for at least 6 weeks before and after surgery. Nicotine is a vasoconstrictor and may increase the risk of unnecessary post-operative complications, such as infection, tissue loss, wound disruption, and delayed healing. Cannabis. Please avoid all forms of cannabis for at least 6 weeks before and after surgery. Cannabis may increase the risk of unnecessary post-operative complications such as infection, tissue loss, wound disruption, and delayed healing. Sun exposure. Avoid direct sun exposure to the incision sites for 12 months following surgery. Use a physical barrier and sunscreen to protect the affected areas. Sun exposure may lead to darkening, or hyperpigmentation of the wounds. Makeup. Makeup may be used to cover neck bruising. General timeline of healing. Have someone stay with you at home for the first 1 to 2 days after surgery. Plan on taking it easy for the first week. Maximum discomfort should occur in the first few days, improving thereafter. Bruising, swelling, numbness, tightness, and tenderness of the skin for 10 to 14 days or longer. You may experience tightness in the neck and difficulty turning side to side for 1 to 2 months. Anticipate a pale, bruised, and puffy neck for several weeks. The neck can look and feel strange and be distorted from the swelling. Wearing scarves, turtlenecks, and high-colored blouses masks the swelling and discoloration. Final result is not fully realized for approximately 6 to 12 months. Every patient is different. Some patients heal more quickly than others. Some are rabbits, others are tortoises, most are in between. Some patients have a tougher recovery than others. It is important for you to take care of yourself by following these post-operative instructions. Healing will progress over time. Most patients feel healed after a few months, but full healing can take 1 to 2 years. Recovery after revision surgery. Recovery is often more intense after revision surgery compared to primary surgery. Side effects may be more pronounced and take longer to resolve. General side effects. Anesthesia side effects. You may experience some adverse effects from the anesthetic medications that were used during your procedure. These effects will range from grogginess to fatigue to nausea and may last for several days after the surgery. You may also have a sore throat from the breathing tube or a sore arm from the IV or positioning. Your prescription will help with these side effects. Surgery side effects. You should also expect temporary side effects such as pain, soreness, sensitivity, bruising, swelling, numbness, tingling, tightness, abnormal sensations, lumpy or wrinkly tissues, itching, crepitus, and fatigue. These side effects may occur at the surgical sites or may be generalized. You may get worse before you get better, so be prepared. Time, patience, and self-care are key. Pain, soreness, and sensitivity. Pain and soreness are expected after surgery. Taking prescribed medication usually keeps the pain and soreness tolerable. Your body may feel extra sensitive after surgery. This will usually improve with time. Bruising. Bruising is expected after surgery. The bruising may travel elsewhere in your body due to the effects of gravity and circulation. Bruising will typically go away after a few weeks. Avoiding blood-thinning medications, avoiding alcohol, avoiding overexertion, and taking arnica montana and pineapple bromelain can help prevent and reduce bruising. Swelling. Swelling is expected after surgery. Swelling is most common at the surgical sites, but you may also experience bloating or swelling of the neck, chest, or extremities. Swelling will usually go away over the course of 1 to 3 months. Abnormal sensations. Abnormal sensations such as numbness, tingling, tightness, sensitivity, and itching are common after surgery. They usually resolve over time, but may take up to 12 to 18 months to diminish. Lumpy or wrinkly tissues. It is common for tissues to be lumpy or wrinkly after neck contouring. This will typically improve over time, but can sometimes take several weeks, even months to resolve. Crepitus. Occasionally you may feel some crunchiness of the skin or soft tissues after contouring. This may be due to residual gas in your tissues. This gas will be absorbed by your body over time. Natural asymmetry. All patients have some degree of natural asymmetry, some more than others. This will persist to some degree after surgery, even if surgery is performed specifically to improve symmetry. Whenever you start different, you will remain different, no matter what surgery is done. Active participation in partnership. It is important for you to know that while your surgeon can perform your surgery, your surgeon cannot heal you. Your healing will depend on a number of factors such as your general health, your willingness to follow instructions, and your mental attitude towards recovery. It is up to you to be an active participant in your recovery process to help your body heal the best that it can. Following all of our instructions is very important, as is working with us to address any complications that may arise. Even surgeries that are done exactly right can have complications during recovery. If we have a concern about your healing, we are going to let you know and to work with you to resolve it. It is important you approach your surgery, and especially your recovery, with the mindset that we are a team, and you are an integral part of that team. We must trust each other to be working for a common goal, your successful results. Positive mindset and self-empowerment. Finally, we would like to talk about the importance of your mindset. Going through surgery can be an emotional experience. Every patient has to go through their own journey. Some have it easier than others. You'll temporarily look and feel abnormal. You will get worse before you get better. You may experience some ups and downs. You may heal quickly or slowly. It is important for you to take control of your own mindset towards your recovery. That means taking care of yourself by going with the program and following your surgeon's instructions and guidance. Going through healing can be an empowering or a disempowering process, depending on how you approach it. It's natural to be worried about your own healing, even anxious or occasionally sad, especially in the early days when your healing looks rough around the edges. Additionally, your friends or family members who are well-intentioned may contribute to your anxiety by making you question your healing because of concerns they raise. But you have a choice in how you recover. Mindset option number 1. You can choose to empower yourself during your recovery by embracing the process, giving yourself permission to be vulnerable, taking care of yourself, accepting your body's natural response to surgery, and believing that your body is amazing. Mindset option number 2. Alternatively, you can choose to suffer during your recovery by fighting the process, needing and expecting everything to be perfect, not taking care of yourself, worrying about your body's natural response to surgery, and constantly focusing on what's wrong as opposed to what's right. Whatever option you choose is what you will experience. It's your choice, but we strongly encourage you to choose the first option, to embrace the process, to empower yourself, to make one with the healing, and to channel as much positive energy as you can. The more positive energy you channel, the better you will heal, and the better you will feel. Stress literally shuts down your body's healing process, so minimize it. Focus on healing your body and spirit. Know that you are amazing. Know that your body is amazing. Know that you are going to heal. Expect improvement, but not perfection. Close your eyes and visualize how great you're going to look and feel. The more you feel and believe this, the faster it will become true. Office visits. You will first be seen back at the office after a few days to a week. Regular follow-up visits will be necessary for proper aftercare. Follow-up visits are your responsibility until cleared by your surgeon. Possible reason for concern. Call your doctor's office immediately if you experience any of the following symptoms: fever of 101.5 degrees or higher for 24 hours or more, significant increase in swelling, pain, drainage, or redness of any surgical site, severe pain not responding to prescribed medication, other symptoms or problems you aren't comfortable with after surgery. In the event of an emergency, call 911 immediately. Otherwise, please call our office at 415-655-7546 if you have any problems, questions, or concerns. We kindly ask that you reserve non-urgent questions for business hours.